tissues in her body because her lungs are damaged, and the intake of the oxygen and the exhalation of the CO2, the changeover there is not working well. So she's not waking up, she's not requiring any sedation. It just doesn't look like that she will survive this. She's not getting any better, and there's not a lot left that anybody can do to fix that. So the question comes,
so when I see the movement of her hand, that's just reflexes.
Most likely just reflex.
And when she opens an eye, that's reflexes.
She's not following commands. We call it encephalopathic, which means that she has altered awareness and altered level of consciousness for whatever reason. Most likely from her is going to be for the sepsis, the infection, the overwhelming infection. My understanding has been that the decision was made already that should her heart stop, that we weren't going to pump on her chest and do all that stuff.
Yeah, they do not resuscitate. Right?
So where we get to now is, what is our end result? What do we want for her, or what would she want for herself? Would she want to be kept on the ventilator like this with all of the medicines and sick and not getting better? Or would she want to be kept comfortable and allow, natural passing to occur? That's the questions we have to ask. And so I always caution families, this is a terrible time to have these discussions, but we have to remind ourselves, it's not really about us. It's about her. And it's so hard to make that transition when it's a loved one. That's all I ask families to think about, is think about what she would want, not how this is going to affect you, because it's going to hurt, it's going to be miserable for the family. But what would she want, and what would make her happy? What does her faith tell her? And you guys' faith, what would you want to have happen? And I think that's the decision that everybody would have to make. Is what would she want, and how would she want this done?
She don't want to live like what she lives, right?
That's kind of what I gathered from
you.
you.
Don't want to live with no wires everywhere. I don't want to hear it.
So, what questions can I answer for you guys?
So you got a time period that this has to happen.
No, time period's on you guys. We can keep doing what we're doing until her heart stops. My concern is, I don't want to put people through things that may be miserable for them. And who's to say that it is or isn't? I know some of the things that we do to people in the hospital is uncomfortable. And that's always my concern when we get down to this stage, is how much torture do we want to actually put them through? Only the families can make that decision. And as the medical person, I'll do whatever you guys ask me to do. We can keep doing what we're doing until her heart stops, and we've already decided that we would not pump on her chest when that happens. We have to just decide what's the end result here. What do we want to see come out of this? Surviving is probably not the option that's going to happen. So I think we have to accept that. The question is, do we prolong it, or do we try to make her comfortable and pray about it? And I tell people, pray about it and be comfortable with the decision, because whatever you guys decide, you have to live with that. And there's no way I could ever answer that for you. And not having been in that situation, I don't know what I would do if it was my family. I think I would want, my mind tells me I'd want to make them comfortable and make sure that the passing was as easy as possible. And I want to be surrounded by all the family. And that's the option that I think we're at now.
Is she experiencing pain? And what's the threshold of pain? Do you know she has pain?
That she's having pain. I would say as long as there's any blood supply to the brain whatsoever, they feel pain.
Okay. So you're treating the pain based on your assumption of that, not that she's indicating what her response is.
If we decided that we wanted to take out the breathing tube and all of that kind of stuff and let her pass naturally, we would give her pain medicine and stuff, once again, because we're not sure she's not hurting. And I would rather err on the side of
she is, because she just can't communicate what level.
And once we make the decision to do what we call comfort care, then I'm not concerned what her blood pressure is. I can give her pain medicine as long as we want to give her pain medicine, because the blood pressure is not my problem and concern for her.
And she can stay here?
Yes. And what I always tell people, a lot of people think that once you take the breathing tube out, that,
it's immediate. Right, it's not.
And it's not. I mean, they can hold on until they're ready to go. And I'll be honest with you, I've seen people here hold on until family came from out of town, and within a day of the family getting here, then they pass. It's kind of weird, we can only do so much on this end. There's a higher power somewhere, and I'm a firm believer in that, that what's going to happen is going to happen. And I can do my part, but the ultimate thing is gonna be, you know, outside of my control. But if she lasted for a period of time after we took the tube out, we could definitely transfer her to a private room downstairs where all the family can be there. If we do anything like removing the tube and stuff up here, I have no problem with all the family being in there. I think that's what we should be doing. We should be surrounded by the people we love when it gets to be that time. Hey, I'm in a family conference. Do you need me right now? Yeah. Okay. Sorry, we just got admission, but any questions on it? How are you related?
Sister.
That's what I thought. Okay. Any questions, guys?
So just to recap, can you speak to the family was concerned about the care she's currently being given and the tubing, that support, and what that means for how long she can sit in this position without the doctor saying or the hospital requiring her to transition self-sustaining without the tube by itself?
I think if we were to try to take the tube out, we can't eat. We're going to work close to it because she's requiring 100% support as far as the oxygenation. And there's a thing that's called PEEP. And normal PEEP is about 5. She's at like 18, and what that's trying to do is force her lungs to stay open.
Expand, right.
And be able to do oxygen exchange and be able to oxygenate her. And the longer you stay on the high numbers, the more damage it causes to the lungs. And like I said, she can stay like this. The problem we're going to run into is that about the 7-day mark, you have to make the decision to put a hole in her neck,
For the tracheotomy.
and to give her a feeding tube. Because it gets to that stage, if this is the life that you guys want for her, and if we were able to get her oxygen down a little bit, the next step would be to transfer her to a long-term acute care facility like Kindred or one of those places. That's kind of the steps if we're going to leave her like this.
So she stays in this state with this machine operating and functioning for her long term. The other damage in turn will cause the trach and other things.
The breathing tube, the longer you leave it in after 7 days, the more chance you have
Infection and stuff.
infection and damage
And
to
damage
the
to
vocal
the
cords,
vocal
and
cord.
her ever being able to have it, have it.
Because it
work
wasn't designed to have something there for 10
Right.
days.
And the longer you have the breathing tube down, the more chances you have of increasing the infection because the body's getting tired of it being in there.
More hands touching it.
But that's kind of where the next step. If the families decide to leave in this state, then we have to move forward with the additional things of putting in a feeding tube in the stomach. It goes from the outside in, because the tube that's down her mouth right now, the little tube that goes into her stomach, again, that causes erosion and stuff if you leave it in. So she'd have to have a feeding tube, and she'd have to have the trach in her neck. And once there's nothing medically that we can do to make it better, then she would be transferred to, they're not nursing homes, they're higher level than nursing homes, but those kind of places.
The hospice type care.
Where and then you have to be hospice.
Okay.
Because if you go to Kindred, you don't have to be hospice.
Okay.
It just means you're not coming off the ventilator. Okay.
Everybody okay with questions?
I'm here all night, guys. Any questions? And let me check with the nurse.
Do you have a phone number, doctor, they can call directly, or you have to be called?
They just call through the ICU. Call the
ICU.
hospital and ask for the ICU.
Okay.
And they'll get me.
Listen, what are the chances of she surviving to come back as she would know?
I think very slim. I would have thought different if she was waking up. She's not requiring any real sedation to stay on the ventilator. So she's not waking up enough to even know that she's on the ventilator and gag and fight and do all that stuff.
Well, listen, I'm going to say this to all who are here today. I had her for 9 years struggling with her illness. I see her went through a whole lot. I don't want to see her go home, born a hole in your chest down there.
And feeding tube and erosion of it, it's too much.
I don't want that.
Yeah. Because it's been 7 days since the tube, and that's the next progression in a certain time frame.
Well, listen, let's find out which way she could be comfortable after today.
Okay. Do you guys want to think about this overnight? And then if that's the case, we can look at taking the tube out in the morning?
No, you can't get the tube in the morning. It's impossible. You have to wait till Sunday.
Tomorrow is Sunday.
Not till Sunday. You have to wait till Monday.
Okay.
I received my minister.
Okay, good.
Talk to him,
Okay.
etc.
Good.
And decide what. Don't do nothing more right now. nobody touch it.
I'm good with that.
And I'm saying, I don't want to put no more tube in her.
So
I
before we
want
get to that stage,
No,
okay,
that's not happening.
okay. Good enough. Do you guys want to see her? All right, let me talk. I keep wanting to pick somebody else's phone up. I'm like, I keep wanting to pick it up.